Two viruses, both attack the lungs, both can leave patients fighting for every breath. But here's the difference. One became a worldwide pandemic that changed modern history. The other is rare, but so deadly that more than half the people who develop severe disease may not survive. And the scariest part? They destroy the body in completely different ways. Today, we're breaking down Hantavirus versus COVID-19, how they spread, how they attack the lungs, why one overwhelms your blood vessels while the other hijacks your immune system, and most importantly, what symptoms should never be ignored, because when it comes to respiratory viruses, understanding the mechanism explains the outcome. Not every deadly virus spreads the same way, and not every shortness of breath means the same thing. Before we talk about what goes wrong, let's talk about what healthy lungs are supposed to do. Every breath you take delivers oxygen into tiny air sacs called alveoli. These air sacs sit right next to microscopic blood vessels called capillaries. The barrier between them is incredibly thin because oxygen has one job: get into the bloodstream fast. At the same time, carbon dioxide leaves the blood and gets exhaled out. Simple, efficient, life-sustaining. But your lungs are not just air filters, they are also immune battlegrounds. Inside the lungs are immune cells called macrophages. Think of them like security guards constantly patrolling for threats. When viruses enter the lungs, these cells sound the alarm. White blood cells arrive. Inflammation increases, fever develops, your body goes into defense mode. That part is normal. The key is balance. Your lungs contain special proteins called ACE2 receptors. Most people only heard about ACE2 during COVID, but these receptors actually help regulate inflammation. They act like a braking system, preventing the immune response from becoming excessive. Because sometimes the virus itself is not the only problem. Sometimes your immune response becomes the real danger. In severe viral illness, it's not just the infection you fight, it's the inflammation your body creates trying to survive it. Now let's talk about hantavirus. Hantavirus enters the body very differently from COVID. You don't catch it from someone coughing next to you. You catch it by inhaling aerosolized particles from rodent urine, saliva, or feces. That usually happens in enclosed spaces. Old cabins, garages, attics, barns. Anywhere contaminated dust gets stirred into the air, and once the virus reaches the lungs, the damage begins fast. Unlike COVID, hantavirus does not primarily target the lung lining itself. It attacks the endothelial cells, the delicate cells lining your blood vessels. That distinction matters, because once those blood vessels become damaged, they begin to leak. Imagine punching microscopic holes into a dam. Fluid that should stay inside the bloodstream suddenly starts pouring into the lung tissue. And then the immune system escalates the disaster. Macrophages activate aggressively. Cytokines surge. Inflammatory proteins explode across the lungs. The leakage worsens. Fluid rapidly fills the alveoli. This is how patients develop ARDS, acute respiratory distress syndrome. At that point, oxygen can't move properly into the bloodstream anymore. Patients become profoundly hypoxic. They feel like they're drowning while still trying to breathe. And what makes hantavirus especially terrifying is how quickly this happens. Many patients go from flu-like symptoms to respiratory collapse in just a few days. Hantavirus doesn't slowly suffocate the lungs, it floods them. In severe cases, patients may cough up blood, oxygen levels crash, blood pressure drops, multi-organ failure begins, and by the time many patients seek medical care, the lungs are already critically damaged. That's why the mortality rate remains so high. Now compare that to COVID-19. COVID spreads differently, completely differently. This virus moves person to person through droplets and airborne transmission. That's why it spread globally so fast. Once the SARS CoV-2 enters the lungs, its spike protein locks onto ACE2 receptors, and this is where COVID becomes dangerous, because the very receptor designed to help regulate inflammation becomes the virus's entry point. The virus binds to ACE2, enters the cell, and begins replicating. Now, your immune system detects the invasion and launches a response, but in severe COVID cases, that response becomes dysregulated. Instead of targeted inflammation, the immune system unleashes a massive inflammatory storm. Cytokines like IL-6 and TNF-alpha surge through the body. At the same time, ACE2 levels start dropping, meaning the body loses one of its natural anti-inflammatory protections. Now, inflammation accelerates unchecked. And here's the key difference. COVID doesn't just damage infected cells. The immune system starts damaging healthy nearby tissue too. That collateral damage is what drives severe disease. COVID turned the body's defense system into friendly fire. This is also why COVID became a multi-organ disease. ACE2 receptors exist in the lungs, heart, kidneys, liver, blood vessels, and gastrointestinal tract. So when inflammation spirals out of control, multiple organs can suffer simultaneously. That's why some patients developed blood clots. Others developed kidney failure. Others developed myocarditis or strokes. COVID was never just a lung infection. So what does this actually look like in a patient? With hantavirus, the first few days can look deceptively mild. Fever, fatigue, muscle aches, headache. Then suddenly the respiratory symptoms hit. Shortness of breath escalates rapidly. Oxygen levels fall. Fluid floods the lungs. Many patients require ventilators within days. And one major clue doctors look for is thrombocytopenia, meaning platelet counts drop dramatically. The progression is aggressive and unforgiving. COVID can start similarly. Fever, fatigue, cough, but severe illness usually develops more gradually. Many patients recover completely at home. Others deteriorate around days 5 through 10 as inflammation ramps up. Blood clots become a major issue. Oxygen levels decline. ARDS can develop. But clinicians usually have more time to intervene compared to hantavirus. Hantavirus is a sprint toward respiratory failure. COVID is often a slow burn that can suddenly explode. Now let's talk treatment. For hantavirus, treatment is mostly supportive. There's no widely available antiviral cure, no approved vaccine, no guaranteed rescue therapy. Doctors focus on oxygen support, ventilators, blood pressure stabilization, dialysis if needed, and extremely careful fluid management, which means prevention becomes critical. Rodent exposure prevention literally saves lives. COVID changed the game differently. We developed vaccines, antivirals like Paxlovid, steroids like dexamethasone, blood thinners, ICU protocols. And that's one of the biggest distinctions between these diseases. With COVID, early treatment can dramatically reduce severe outcomes. With hantavirus, patients often present after catastrophic lung injury has already begun. So who's most at risk? For hantavirus, risk is highest among people exposed to rodents or rodent droppings. Farmers, forestry workers, construction workers, people cleaning old buildings or cabins. Anyone exposed to contaminated dust. If you've been around rodents and suddenly develop fever, fatigue, and shortness of breath, seek medical care immediately, because symptoms can escalate frighteningly fast. For COVID, the highest risk groups include older adults, immunocompromised patients, pregnant individuals, and people with chronic illnesses like diabetes, obesity, heart disease, or lung disease. And if you develop worsening shortness of breath, chest pain, confusion, or persistent fevers, especially if you're high risk, you should contact your healthcare provider immediately. Here's the bottom line: 2 respiratory viruses, 2 very different biological attacks. Hantavirus destroys the blood vessel barrier inside the lungs, causing catastrophic fluid leakage and rapid respiratory collapse. COVID hijacks inflammatory pathways, disables protective ACE2 signaling, and triggers widespread immune dysfunction throughout the body. Understanding these mechanisms matters, because medicine is not just about memorizing symptoms. It's about understanding why the body fails. If you work around rodents, take precautions seriously. If you're high risk for COVID, talk with your healthcare provider about prevention and early treatment options. And remember this: the lungs can fail quietly at first, until suddenly they can't keep up anymore. If you found this breakdown helpful, subscribe to the channel, share this with someone interested in medicine or public health, and I'll see you in the next episode of Medicine Mondays.